Okay, so Andrea and Ashley, I think we will get started because I know you've got something coming up next as well. Um, so welcome to everybody out there in Zoom land. It's kind of odd doing it this way where we can't see you, but we know that you're there. So it's actually great to be here today. After such a long journey, we launched these competencies in the Mansion House in 2018, and a lot of you were there on the day. And this is really exciting that we're on the next step of that journey. I firstly want to really thank our loyal members because there's many of you have been chomping at the bit for endorsement, but you've also been waiting really patiently for this. And I think COVID has gotten in the way and it's just taken a lot longer to get here than planned, but here we are now. I also wanted to thank our private benefactor who has made this possible by providing IAIM with the much needed funds for this process. We wouldn't have been able to do this without the person without their support, and also the vision of the executive committee members who past and present who have brought us to this stage. We have a committee of 12 volunteers who worked tirelessly in the background to make all of this happen, and it's no easy feat. We've literally just taken a breath from hosting WAIM, the World Congress on Infant Mental Health last year. And as a committee, we're ready now for the next phase of infant mental health in Ireland. I'm going to hand you over in a moment to Andrea Penick and Ashley McCormick. I'll just tell you a little bit about them. They're joining us today from Michigan, where they're attending the biannual Infant Mental Health Conference. Andrea works for the Alliance for the Advancement of Infant Mental Health. Andrea began her social work career providing home-based therapy to young children and families. She's been providing reflective supervision and consultation for the past 7 years. Andrea's work centres around supporting the infant mental health workforce, systems-level equity work, and research and programme development in infant mental health. Originally from Chicago, Andrea is currently located in Michigan and is endorsed as an infant mental health mentor clinical. Ashley McCormick works for the Alliance for the Advancement of Infant Mental Health as the Interim Executive Director. Ashley is dedicated to promoting workforce development standards for all professionals who work with or on behalf of pregnant people, infants, young children and families through direct partnership with other child-serving organisations. Ms. McCormick has experience providing relationship-focused therapy, serving as a provider of reflective supervision consultation, and implementing workforce development initiatives for the infant and early childhood mental health professionals. Ms. McCormick's training includes a bachelor's degree in psychology and child development from Central Michigan University, a master's of social work from the University of Michigan, and a financial success for nonprofit certificate from Cornell University. So without further ado, I'm going to hand you over to both Ashley and Andrea. Just to let people know that have joined a bit later, the chat is disabled, but you can put in questions into the Q&A. And we have myself and Sharon her camera is off she's also on the committee in the background, and we'll monitor those questions. So we'll have time for some questions and answers as the afternoon progresses as well. Okay, so I will hand over to Ashley and Andrea.
Awesome. Thank you, everybody. We're super excited to be here. We were with probably many of you last summer in Dublin for WAIM, so we're excited to be with you today virtually as well. Before we get started, we just wanted to do a little informal introduction as well. So like Hazel said, my name is Ashley, and I've been in the field of infant early childhood mental health really since the beginning of my career. I was doing an internship working with older kiddos, 7 to 17-year-olds and their families. And when I was going on those home visits, I kept noticing that the parents or the caregivers of those children kept leaving the room when I came, and they really didn't see themselves as a part of the support and the services that I was trying to provide their family and their child. And so I went back to my supervisor and I said, why is that? Why aren't these parents staying? And she said, oh, you're probably one of those people who wants to work with the babies and the toddlers. And so I didn't even know that was a thing. That was when I was in graduate school. And so she got me connected with people doing infant mental health work. And so I've really been doing it ever since that time. And really from the very beginning, saw the value of working with a dyad on behalf of a child to really get those long-lasting results that we're hoping to see. So I'm excited to be here today and just share some of what we've learned around supporting 35 US states and 2 countries so far in using this endorsement credential.
And I'm Andrea Penick. My background is also in home visiting therapy as well. And I really started out doing placement preservation with families that had been in foster care or adoption, and the families were feeling like this just really isn't working. I don't know what to do to support the child, or the behaviors are so big that I don't feel like I can sustain parenting this child. And our goal was to like get in there really quick, and before they were saying they're fully done, and provide any support we can, particularly emotional support for the parents, and like really helping them be with that child, and settle into that space emotionally enough to start, reading cues and understanding and trying some different things, because they had somebody sitting with them to kind of help co-regulate them so that they could co-regulate the baby. So I was really passionate about that. I also had my daughter when I was 20, so I was a young mom. And I absolutely loved 0 to 3 with her. Like, everything about that age and her learning, and how quickly the development stages were happening, and just the way that we sort of like mirrored each other and played with each other and interacted, made me really passionate about that age range. So I just kind of naturally just kept inching my way closer to that age range, and then served 0 to 6 for many, many years, in Chicago and in Michigan. And now I support Alliance, and associations across the world. So a lot of my work involves kind of a consultation with associations to help them think through how to best support the workforce at large. What do we need to do to kind of help this field, where many professionals in the field are going into homes or doing policy work or doing research in the field, and really trying to like champion for infant mental health, and having, I think still in a lot of our communities, really trying to carve out a space where that means something, where infant mental health really is a concrete specialization. And so my work is really supporting on the larger scale, how to like systematically support that workforce and that work that's getting done. So I do that through supporting associations. I do that through providing reflective supervision, with a focus on providing to people who are providing to other people. So sort of like that systems approach, really trying to get the field bolstered, so that the direct service staff have what they need in all of their sectors, and then do that through some training as well.
Yeah, so Andrea did give you a good sort of overview of what the Alliance does. So the Alliance is a national and international organization primarily working with those 37 infant mental health associations who have all agreed to use the Competency Guidelines and Endorsement, which you'll hear a lot more about in a little bit, to whatever way supports their state or country. So the Alliance really is kind of like the umbrella that supports those 37 associations, because we want the competencies and endorsement to be used and thought about similarly. And we know that each of those 37 places is very unique and has their own needs and understands their own workforce and babies and families very uniquely to that area. So we try to provide like the framework and the policies and procedures and the support that an association needs to then go do that in their local place. So we'll talk about the parallel process later today. And if you're here, it's probably not a new concept to you, but we sort of think of our organization in that way. So we support the AIMHs, who support the workforce, who support babies and families directly. So hopefully by the end of today, you'll have a better sense of how the Alliance does that and how the endorsement is a tool to do that through. So here's just a snapshot of what we're going to do. We're going to give you a little history, talk about the competency guidelines and then endorsement, talk about reflective supervision briefly, give you an overview of what does it mean to be now a member of the Alliance, an international organization, and then we'll be sure to save a lot of time at the end for questions and answers, but we'll also be pausing throughout the presentation to see if there are any questions. So like Hazel said, be sure to use the Q&A feature. All right. So just like a baby's history is important to the baby's development, so is our history to the creation of the competency guidelines and endorsement. We just want to give you a brief overview of the history so that as you go out and champion endorsement and the competencies and really be an ambassador for these things, you have some sense that they came from a long time in the making based on a lot of different pieces that were happening over the course of the dates here on this timeline. They didn't really just kind of like poof appear one day. There was a lot of support around their development. So in the 1970s in Michigan, a woman named Selma Freiberg coined the phrase infant mental health, and she developed infant mental health treatment approaches for infants, toddlers, and their families. So Andrea and I were both kind of trained and brought up in that model, and that was called infant mental health home visiting, and that is still a model used here in Michigan and being spread across the nation right now. Later in the 80s, legislation was passed that was requiring family-centered service coordination in the United States. And so there started to be more and more conversation around what sort of competencies people needed for working with 0 to 3-year-olds, specifically who had disabilities. So the Michigan Association for Infant Mental Health was in operation at that time. And so they created a document that was really around training guidelines. So if you were working with 0 to 3-year-olds, what sort of training did you need? And that was in the late 80s. 0 to 3, which is another national organization here in the States that I'm sure you are familiar with. They then published a document kind of building even more on preparing practitioners. So thinking about training, but then even more so, what else do practitioners need to work with infants, toddlers, and their families? And so that gained some traction. And then the Michigan Association for Infant Mental Health was really, there was a lot of cohesion at this time around this topic, a lot of interest. And so they brought together an interdisciplinary committee of volunteers to build upon these competency areas that were being dropped in these different documents across the nation and really being talked about at the time about like what does competence mean for professionals who work with little ones and their families. So Maine brought together that group and they wanted to come up with a thorough set of competencies. And so that is, that's what led to the competency guidelines being created. The Michigan Association secured funding to finalize this competency set, the competency guidelines, and then this led into the endorsement framework. And they weren't really planning on that happening. They just came together to focus on these competencies, but realized that the competencies laid a foundation for this endorsement framework. And the endorsement framework allowed people to sort of systematize those competencies within their professional work. So the competencies and endorsement were finalized in 2002. And the Michigan Association began using them. They did not intend for 37 total infant mental health associations to be using them at that time. They just began using them. It was really supporting the workforce in Michigan. And then a really grassroots sort of effort began where other infant mental health associations started reaching out to the Michigan Association, just really curious in the beginning, wanting to learn more about the competency guidelines and endorsement and think through whether it would be a good fit for their local regional states and countries. And so between 2002 and 2015, 15 infant mental health associations licensed the competencies and endorsement. So again, it was really grassroots. It was something that just grew over time. In 2014, 2015, the Michigan Association for Infant Mental Health was like really blown away and really felt their efforts being pulled from Michigan and really focusing more on these states and countries that were reaching out for TA around the competencies and endorsement. And so at that time, the Michigan Association Board of Directors chose to create a new organization. And so that is when the Alliance for the Advancement of Infant Mental Health was created in 2016. And so the Alliance now sort of moved all of those aims That's what our short acronym for Infant Mental Health Association is, AIMS. So the Alliance began focusing just on all of those infant mental health associations who had licensed endorsement and the competencies. The Michigan Association went back to focusing just on the Michigan workforce and those professionals. So we still have a very close relationship with the Michigan Association for Infant Mental Health. These are their competencies, their copyright, but the Alliance really now operationalizes what the endorsement and competencies look like in these 37 places. So that's a huge thing that happened. At that same time, endorsement had only been for people working with 0 to 3-year-olds. And so we were hearing from the workforce that there were many professionals who work with 3 to 6-year-olds, but used infant mental health principles and practices to inform that work. And so there was a call from the workforce to expand endorsement to be available for also those working with 3 to 6. So there's also an early childhood mental health endorsement. We won't be talking about that today, but there are some associations of those 37 who, in addition to infant mental health endorsement, also have the early childhood mental health endorsement. Also in 2016, we translated endorsement so that it is available in Spanish. So that was another effort to kind of broaden who endorsement could be available for. Also throughout that time, we kind of formalized the Alliance more. And now here we are in 2024 with all of you. So it's been a long journey. And I think the important thing for you to know is that these competencies have done a substantial job supporting the field, and we're always evolving them. So you'll hear a little bit today about the endorsement requirements and how they've evolved to meet the needs of the workforce as the workforce is changing to meet the needs of babies and families.
So here we are today. This is just a visual to see what states and countries have begun using the competency guidelines and endorsement. Everything in green are our partners who are fully using both competency guidelines and are rolling out endorsement. I don't know if you can find Ireland on that. Just kidding. There's a star around Ireland. And then the ones in blue have taken on the competencies, and they're kind of in consideration, determining whether and when they'll do endorsement. So it's really cool. A lot of these states started off with a couple of people who are really passionate about this work, and either started an association for infant mental health or connected with the one that already existed in order to bring endorsement and the competencies to their community. So a lot of this work has started off rather small, with really key partners, and has grown into this sort of international credential, which is really exciting to think about, particularly as Ireland gets started. You'll be growing especially in the beginning years, and really identifying like who all is doing this work. Not everyone in the country, I'm sure, has been connected or is under an umbrella professional hub yet. And so as you keep going, you'll be meeting more and more people who are also similarly passionate about this work. What we found also is we find people who have felt really isolated in this work. And I know for myself, there's times in my career where it felt like, especially if you're not connected with a larger network, that like this work is unique and it's uniquely challenging. And I used to say high highs and low lows. And so what we find a lot is that people who felt they were really isolated in their work are so excited to be connected to something bigger, where there's more people who are just like, they have that fire in them about this work and that passion, and they're doing infant mental health no matter what. And so having the people around them and the supports has been huge. So we've grown quite a bit. It's really cool because if you're endorsed in Ireland, your endorsement is recognized in any of these other states or countries that are green. And you can also you have to be in a state that is green, that has taken on endorsement in order to become endorsed. So if there's anyone out here who's not in Ireland, who's not from Ireland or living in Ireland, I mean, if you're living there, then you definitely might be one of those pioneers in your country to bring endorsement there. but it's a growing community. It's been really exciting to kind of see all of these different communities grow and evolve. And that growth from all of these different communities supports the evolution of the endorsement credential. Like, it is designed to continue to support the workforce, which means as we learn more about Ireland, as you all get connected more and more to the community out there and the needs of the babies and families out there, that will inform this credential as well. We really want it to be designed to fit the needs of everybody. And so a lot of our work, particularly in the past 5 years, has been evolving this credential and really thinking through barriers that anybody faces in becoming endorsed, or what's not captured in it, what is unique to other families that should be part of this. Because we've learned, I've been working with Hawaii since I first started working with Alliance, and some of the way that they work with babies and some of their understanding and their practice is different and has deepened my own work in the field. And so I want that to be connected to the rest of everyone under this Alliance network. And that will be the same for Ireland too. There'll be ways in which you'll be learning from this competency guidelines, but you'll also be a contributor that other people will learn from as well. And that's part of what makes the community really exciting and successful. What is infant mental health? I think that's one big question that comes up a lot when people are like, am I a part of this network? Do I do infant mental health? There are some, what we call, and you'll kind of hear us say throughout it, scopes of practice, which is just like the different types of work, the different ways in which professionals are working with the 0 to 3 population. There's a lot of scopes of practice where professionals are touching the lives of this population. And sometimes it's really clearly infant mental health. Sometimes you might already be calling yourself an infant mental health professional. You might be doing infant mental health therapy. When I started in infant mental health, they said I was an infant mental health therapist, and I was like, okay, great. But there's also a lot of professionals who are supporting and bolstering healthy mental health for this population that maybe have never called themselves infant mental health professionals. So the way that we sort of think about it is anybody who works with or on behalf of children 0 to 3-year-old or pregnant women are part of this infant mental health community. They're often supporting the social emotional well-being directly with children, directly through the parents, or in their work supporting the systems around the child. So you may be an early childhood educator, and you may in your mind, your career says you're an educator, you're a teacher. We also consider you an infant mental health professional, because in order to be successful in education for that age range, you are considering regulation of a 0 to 3-year-old. You're considering the emotional needs. You're holding in mind the relationship of the caregiver. And when a child shows up to a home daycare or a preschool setting and they're having a rough morning, your mind is kind of wondering about what that morning was like for them when you weren't a part of it, in order to support them, in order to support their transition into the classroom and their social emotional development and their development of social skills with their peers. So there's a lot of ways in which your work is supporting mental health. And that's sort of what connects you to this infant mental health community.
All right, so we are going to transition into thinking about the competencies. I loved that Hazel held up your version and exactly what that looked like. Sorry about the emojis. I'm a hand talker, and sometimes my computer picks up an emoji that it wants to share with you. So it's probably going to happen a few more times today. So here's the visual of what the competency guidelines looked like here in Michigan. And then hopefully you all still have yours from 2018. So why a competency framework? So I shared sort of like the evolution, how they came to be, but why do we believe a competency framework is so important? So we know, like Andrea just shared a little bit, in order to support the optimal early relational health, support for professional development initiatives in this field is a crucial strategy. Providing services to vulnerable babies, young children, and their families, particularly those facing chronic adversity, is challenging, and it does require a unique set of specialized knowledge and skills. In order to meet these demands, the workforce must have access to competency-based professional development and reflective supervisory experiences that support their work. And we believe that the competency guidelines lays out what those specialized knowledge and skills are, in addition to providing the framework for endorsement. So we do think that the competencies and endorsement combined set a standard that allows professionals to document their professional or their specialized experience to really show others that they have expertise and credibility within this specific field.
The competencies is really interesting because it sort of like is this framework that is to shape the field. Like the workforce is going to be working to kind of make sure that they have, basic understanding of the competencies. They want to, it's saying, hey, here's these knowledge and skills that we think a professional should have. And then we are anticipating that the workforce is going to kind of go out there and find trainings to develop that. And people are going to develop trainings holding in mind those competencies. And the workforce takes that back to the families. But the workforce is also everyday learning from the families about what works, what doesn't work, what do they need to know, what skills are showing up and are effective in their work. And that's evolving as our communities evolve. And so what at the same time is happening is that babies and families are shaping the workforce as well and shaping the standard by communicating to families, all of that. What works for me? What do I need? What do I need from a professional coming into this space? What do I need from systems around me? And then the workforce informs the competencies. And this has happened like in an unwritten way since the competencies existed, where we've kind of just keep growing and learning about what the workforce needs, and we're evolving our trainings. But the written competencies haven't changed in 20 years. We've had I think 1 or 2 really notable changes to the language, but we've built up all of this information around, how our communities have grown. And so right now we're working on updating the competencies to really incorporate what the field has learned, what's really important in the work that they're doing. And it's because it's super important to us that the competencies encompass that, so that then it's then informing the workforce again. It's informing people who are putting on trainings. It's informing systems who also want to support what's best for babies. And the cycle has to keep kind of happening so that we're growing together with the field, with the babies, with the workforce, and then strengthening the mental health of children internationally. So we've noticed kind of this cycle and pattern. We'll be developing a new a revised set of competencies that encompasses everything that we've learned, and we're setting it up so that can continue to happen less than every 20 years. We'll be updating our language really regularly because this field grows quickly, and it's what's best for babies is to be the most informed.
So what's on the screen right now are the competencies that you are familiar with. This is what's in the booklet that you have and what you would have heard about in 2018. These will be revised, like Andrea just said, sometime in early 2025. So you're coming in at a really exciting time to sort of hear where are we right now? What's going into the thought process around changing things? And then you'll get to start this process with those brand new set of competencies. I don't know how drastically different they'll be. I think in some ways they will be, some of these things won't be here anymore. Let's say listening and speaking and writing, but then other things will really be broken apart and really, zeroed in on even more. And so if you look at the theoretical foundations, you'll see that there are many competency areas that are really broad and bundled together with other things. So pregnancy and early parenthood are together. Attachment, separation, trauma, grief, and loss. Those are 5 huge topics that are all one competency area. So I think in the revision, you will see things broken out and really given their own space to have to provide more clarity. I think that we often hear from the field, how do I meet pregnancy and early parenthood? That's what sort of training meets that? And so we're hoping that the revised competencies will be more specific in some ways that will provide clearer direction to the workforce and to really support the workforce in seeing themselves in doing this work. Like, oh yeah, when I'm doing my job, that is how I think about attachment, or that is about how I think about trauma. So here you'll see the theoretical foundations, direct service skills, and reflection. Those are sort of like the big three domains of the competencies. That's where we have the theoretical foundations, which is where people are really like, what do they know? What sort of topics does one need to know in order to do this work? And then the direct service skills, that's where we have like our doing. So observation and listening, screening and assessment, advocacy. Those are things that we know how to do in order to do this work. And then we have reflection, which is our way of being. So contemplation, self-awareness, curiosity, professional and personal development. So those sort of three, I like to think of them as like the three like legs of a stool, kind of uphold the rest of the competencies and provide guidance for those who are in the field and they're thinking about like how their ways of knowing, doing, and being.
I see a question in the chat. I wonder if it's a good time to.
Oh yeah, we can pause. Yes.
Yeah, it will be out of date, but there will be like really clear guidance on when you've developed the competencies that are currently here, what does that mean in the context of the new competency? So nothing that you've developed or learned is lost. It will be evolved upon. And I think it's important to note with the competencies is it's not expected that everybody has had a training in every single competency. It's a framework where that's going to guide your practice as you continue in the field throughout time. So what you've learned doesn't go away. And we want really the competencies to be like a continued pathway where, for example, let's say you are really interested in pregnancy and early parenthood. Now you'll have some more things to kind of like look closer into, like in utero substance abuse might be really relevant for your work. And so there'll be like a further path for you to go on as you continue your work before, after endorsement, throughout your whole kind of journey in this field.
Mm-hmm. And the competency guideline booklet, that used to be our main way of disseminating that information, which was a paper booklet. And that's just really not the way that you get information out to the world anymore. And so we have moved the competency guidelines to being digital, and then there will be a digital PDF. And so we'll be able to update things in real time more frequently than we did before. So there used to be changes, and then we wouldn't make updates to the booklet. And so people wouldn't always have the updated information. And so we'll be moving everything to an online version and then updating it in real time. I know that there will still sometimes be a use for like a hard copy. Nothing will ever be able to replace that, but we will be trying to move everything digital so that people are always having up-to-date information. All right, so we are going to move into endorsement now. So I'm sure this is where people are going to have the most questions and curiosity around what this might look like for you. So the endorsement is really, I mean, IAIMH's commitment to bringing best practices in the field of infant and early childhood mental health. That's what this demonstration of licensing the endorsement means and what really brought us all together here today. And as Andrea said earlier, talking about what is infant mental health endorsement and who is it for is the same answer. Really, infant mental health endorsement is for anyone who works with pregnant people, babies, families, or on behalf of them in more indirect roles. And so if you're here today and there's probably a category of endorsement that is a good fit for you. So endorsement really recognizes that competency that professionals gain in their professional experience. Endorsement verifies that endorsement applicants have attained a variety of things. It may be a certain degree, that they've participated in in-service trainings that are specific to the competencies, that they've worked in certain capacities to deliver high-quality relationship-focused services to or on behalf of infants, young children, and their families, and for some categories that they've received reflective supervision. So it's kind of like a culmination of all those things is what leads to endorsement. So I often think of endorsement as like the requirements are all each a slice of pie, and it's really looking at the whole pie together, someone's whole endorsement application, to determine if they've met the requirements to achieve endorsement. Endorsement is intended to recognize all of those experiences that I just named that lead to competency in this field. I don't know that you talked about, you do need to live in one of those 37 places that have licensed endorsement. But what we haven't said yet is that only an infant mental health association can license endorsement. So the Irish Association for Infant Mental Health, they are the holders of the endorsement license. It is their role and a responsibility to oversee that and administer the endorsement credential, and no one else in the country can do that. So there's only one organization that can do that in all of the US states and in each country, and that is the local Infant Mental Health Association.
I just want to say one other thing in relation, what is endorsement in relation to the competency guidelines? I think it's nice to kind of think about the competency guidelines as the framework, like what are the knowledge and skills? What are we doing in this field that's so specialized and important? And then endorsement is the tool where a member of the workforce can demonstrate that they've met, like a standard of what someone should know from the competency guidelines. So they're a little bit separate, but endorsement is really a tool to show the competencies and show your expertise in the competencies. Endorsement is also it's not a specific set of training. So it's really a journey. You're capturing what you've maybe already have, what trainings you've already participated, what work you've already done in this field, and or what you'll be maybe learning more about what you want to capture or need to capture, or you'll begin your journey in the field and your endorsement at the same time. There's not really a wrong way, but endorsement sort of journeys with you versus it being a curriculum or a training that you participate in and then you're done.
All right, so diving more into endorsement. Endorsement, I referenced the endorsement application. Endorsement is like a verifiable process in that way. So when you identify that you want to begin the endorsement process, you actually begin an application and you enter all of the requirements into the application that is then reviewed by an application reviewer. And some categories of endorsement do also have an exam. So there's some sort of like checks in terms of the endorsement application. Endorsement, again, just indicates someone's desire to specialize in infant mental health. And so if you are a pediatrician in the group or a home visitor, or maybe a policymaker, you've already sort of distinguished your area of focus in your career. And then the infant early childhood mental health endorsement is just another layer on top of that to say, I do that work with a focus on 0 to 3-year-olds. So we've often heard from professionals that they didn't get that in their schooling. So I'm a social worker. I did not take many courses, if any at all, on babies and families. And so by myself getting this infant mental health endorsement, I'm then able to show other employers or people in my network that I sought out this additional credential, which includes 30 hours of training specific to infants and toddlers and their families, to say, like, I'm now a social worker who also deeply understands and knows infant mental health and those principles and practices. So it's a way to highlight one specialty, regardless of what your education and current work experiences might be in.
Competencies are developed in many different ways in a professional's career. An endorsement looks specifically at work experiences, training and professional development experiences, and reflective supervision as the 3 key ways that somebody really kind of develops and like nurtures their competencies through their work. Work experience is often where professionals develop their direct service competencies. So like assessment, screening and assessment tools, observation, listening, a lot of that is through practice, through having done it with families. These are the competencies that we refer to as what we do in the field. Professionals development is an important area where we capture what we know in the field. Those are things like when we're learning more about attachment formation or attachment styles, or if we're learning about developmental milestones, we may be doing a training to sort of develop those competencies. And then reflective supervision is really one of the core areas where we think about developing the competencies around our way of being. And so our reflection and our curiosity with families, the way that we kind of can sit with them and sort of hold in mind the parallel process and the impact of the parallel process in our work with them. That's often done in reflective supervision, but often all of them are kind of happening in each, and each professional is able to kind of think through where they're developing competencies. You may have learned a lot about attachment formation in your reflective supervision relationship, or you may have taken trainings that really bolstered your curiosity and your way of being with families. But these are the three ways in which endorsement really captures that you're kind of have developed like the knowledge and skills base that we're trying to capture as being kind of a standard for working in the field.
I do see a question.
We have, somebody asked in the chat about curriculum for the exam, if they're applying for a category that requires an exam. And we have an exam packet that really helps if you're taking an exam, if you're applying for a category that has an exam, we have an exam packet to support professionals in kind of knowing what to expect about them. It sort of explains what each exam is sort of asking for or going to have you kind of dig into. And then it has a list of resources as well to help you with study. There's also a section in there about how to use a peer or a mentor or a reflective supervisor to practice writing or to kind of explore areas where you'd want to like take more trainings in or get resources in. It's a lot to look at a list of resources and think, okay, what haven't I read on this list? Rather, we want to support people in kind of like that reflective journey, really identifying where your gap areas, which the endorsement application will support you with. They'll say, okay, I see you have trainings in these areas and you don't have trainings yet in this. And so that might be areas where you want to lean into in preparation for the exam, but then also your relationships and any reflective or mentor space that you already have is a great area to sort of lean into. You know, what are my gap areas? What are the areas that I really want to focus on in preparation? And then the exam packet will give you, you know, some guidance around that to help you hone in and structure your preparation.
Yeah, all of those documents are on the Alliance for the Advancement of Infant Mental Health website within the endorsement section, but we can also link to it before the presentation is done today. So usually a big question at these presentations are, why endorsement? What's the value? What's the research? How do we know that it helps people, specifically babies and families? And so I just always like to give some space to talk about what we have done and where we imagine going in the future in terms of research on endorsement. So in 2022, we conducted a survey called Perceptions of Endorsement, and 911 endorsed professionals completed that survey. They completed it voluntarily, and 28 of probably like the 32 infant mental health associations at that time participated. Ireland would not have participated because it only did go to endorsed professionals, but we did have participants from Western Australia at that time who participated, and their results are representative in the data. Before I go over the results, I just want to say our survey set is limited because it only went to endorsed professionals. So someone had to be committed to completing endorsement, have the resources to complete endorsement, and then also have the time to complete a survey on endorsement. So just as you hear those results, just keep that in mind. So here are some of the things that we have learned. We specifically inquired about how endorsement has influenced the work that professionals do. And the top 3 responses that we we bucketed them into the following themes. The first theme was that endorsement influenced their work by helping them have improved knowledge, plus opportunities for learning growth, increased credibility and recognition as an expert. That was a theme that really rang through all of the entire survey, and then improved confidence and personal satisfaction. So I'll just read through some of these. So nearly 1/4 of the respondents reported that earning endorsement influenced their work by improving their credibility, and helping others see them as an expert. So we heard this often from professionals who were working in child welfare, specifically around, when I went into whether it was court or a child family planning meeting, and I was able to say, like, no, I'm working with a 2-year-old and I have this infant mental health endorsement. I really know what's best for babies and their families. That really gave them a sense of credibility that they didn't feel like they had prior to earning endorsement. We also inquired about what would you tell others about why they should earn endorsement. I think we all know that a personal recommendation from a friend or a colleague goes a lot further than maybe just seeing a flyer about why you should do something. And so the top responses, we heard 4 themes really bubble up the most clearly. The first one was that you're a better provider of services for babies, young children, and their families. So respondents said that they believed earning endorsement led them to be able to provide better services. And this is where we need to look deeper into why, because if you go back to endorsement as a whole, it's a pie with a lot of pieces. Did people feel like they were a better service provider because of the training they sought out, or because of the reflective supervision they got? We're not exactly sure what part of endorsement allows them to feel like a better provider, but that is the overall sense. Theme number 2, again, credibility, and that ended up being defined as being trusted and believed in. So really having something that gave people a stronger voice when they were advocating for babies and families. The third theme was increased infant early childhood mental health knowledge, which goes back to what I shared on the previous screen. It's that the initial training requirement for endorsement applicants is a minimum 30 hours of training. And then there's also an annual renewal. So endorsement is like you're honoring all of the experiences that you've had to date to earn this credential, and then you're continuing your ongoing professional development. We really believe that you're always learning and growing and evolving in this field. So I'm not surprised that increased infant early childhood mental health knowledge came up. And then Andrea referenced the networking and the opportunity to be part of like a professional home. And that came up really strongly around what endorsement has, like joining this network of people has really opened the doors for people to be part of a bigger, broader community. All right. And then we further explored what factors specifically related to positive attitudes regarding endorsement. We knew that we had a pretty biased sample size in that everyone had already earned endorsement. And so we wanted to think through, like, what could we pick apart from that? So we did learn that having positive social influences really helped. So if you knew others who had also earned endorsement, it improved the likelihood that you would have a positive attitude around endorsement. And we have heard that from infant mental health associations, that the best strategy to get people endorsed is to get them connected with a group of people who have already earned endorsement. So some infant mental health associations use like cohort models, connecting people with peers. If you have a reflective supervisor who's already endorsed, I know people feel even more supported as they then embark on their own endorsement journey or sit for the endorsement exam. So really thinking about, as you all think about what this might look like in Ireland, thinking about how to use those peer and social connections. The next thing that we looked at was the perceived impact of endorsement on opportunities that an individual has for mentorship, advocacy, research, and new job increases the likelihood that they'll have a positive view on endorsement. So there were a lot of things that came up around, did earning endorsement lead to increased pay or a promotion? For the people who it did, they viewed endorsement more positively. And then the last thing that we were able to pull apart was that the impact of endorsement on an individual's confidence and motivation improves the likelihood that they had a positive view on endorsement. And so if they were more confident and motivated to get this done for themselves, and really, I mean, we really heard some like really beautiful sort of testaments from people about why this credential meant so much to them. And then, not surprisingly, they viewed it more positively.
Here's just a little bit about what some people said specifically about endorsement. This first one, they're just really talking about how it illustrated their expertise in the field, and it's an advocacy tool. I kind of like that they said babies have a small voice in this world and they need advocates who can speak loudly for them. Being endorsed allows for you to address the day-to-day stressors for infants, young children, and families. And that's been a huge piece for people, is like they've been a voice for babies. They've developed that in their relationships with infants and young children. And then endorsement has really allowed them to be kind of an advocate on a larger platform to kind of carry that voice into other spaces. Ashley mentioned court really quick. That was a big part of our home visiting work, was sometimes going to court for families as they're moving towards reunification or not. And I think before I was endorsed, when I was sharing the voice of the family, I think I could kind of just be viewed as a sympathetic partner with the family. But as you know, I both had the credential behind my name, but then also had the shared language of endorsement, and my advocacy voice became more of like an expertise and a really specialized knowledge that informed what I was seeing with families and how I was carrying their voice. And it carried more weight in court. People way more often listened to my recommendations and therefore listening to the family and the family's needs a lot louder. The second person just talks about how it's career changing. Endorsement equates to credibility to me. That kind of fits as well, of like in the story that I just shared for myself, of I was more credible. People were more willing to take what I was saying as an expert. I don't know if you ever get this in the field where people, oh, you like must love babies. And it's like, well, certainly, yes, I do very much love babies, but also I like love our future, our community's future. And like, I believe that I'm building towards that. I love social justice. I love science and brain science. And so all of that is fueling it, not just my like love for little human beings and their families. So having that credibility has been really important for a lot of professionals as well. So this is where we'll dig in a little bit more into scopes. Can we check for questions just really quick? Oops.
How do I get that to show up?
Sorry, it's hard for us to like,
Oh,
here's when it wants to appear. Okay, cool. No questions. But yeah, keep adding them in as they come along. So here's what we'll dig in a little bit to scopes, and I'll use myself as an example as well, because there's space for everybody, every profession in the field, and you sometimes move professions. It's not hierarchical. You're not building towards a specific category necessarily. I really like to think of it as like a pie, and like every piece of that is essential to supporting infants and young children. We have to have professionals, experts, leaders, advocates in every scope of practice for the community to be strong and healthy. And so the way that endorsement breaks it down is in what we call scopes, and that's promotion, prevention, early intervention, treatment, and then macro. And promotion is really, it's for professionals who are bringing like the infant mental health principles and practices into their work. They're sort of carrying the torch to say like, these are really important things across the board for people to know and understand and integrate. This broadly captures a variety of professionals, educators, medical professionals, case managers. It's often, I'd say like in this category, I often think about, you might not call yourself a mental health professional. You might have gone to school to be an educator, or you might have joined a career to be in the medical field. but you're choosing to promote infant mental health in that work because you know it benefits your work. You know that if you understand attachment relationships as a doctor, the way that you can talk about physical health, the way that you can integrate healthy changes for families is stronger. You're more effective in your work because you're kind of holding infant mental health principles and practices and really promoting them in your work as a medical professional. I'd even say like right now in my career, I technically would fit the promotion category the best because I'm doing this consulting work and I'm doing trainings and like that's kind of my core title, or I'm doing like program development. But I'm doing it with the infant mental health principles and practices in mind. I'm really promoting those through the training and the consulting that I'm doing because I believe in the effectiveness of them. I believe in that they're very important. The second category is our prevention, early intervention scope of practice. And this is for professionals who are sort of in the field of trying to intervene or prevent mental health issues from developing or progressing with families. It's leans into a lot of these professionals are really broadly understanding an infant's needs. They're learning a lot about what's happening for an infant and their family to get a good sense of like holistically, like where are we at? Like they may be, a family may have some concerns already, but like we're trying to understand where's the root of this? What does this family need to feel successful in their parenting, to feel successful in having a healthy relationship and social emotional development. So these professionals are learning a lot about the families broadly. And then oftentimes they'll refer out to specialists. If they find that there's a developmental need, they may refer out to an organization that will do physical therapy or assist with like learning development. Or if they find that there's early childhood trauma or a mental health diagnosis, and they'll refer out to a therapist who will then like really target what they've identified. So they're really holistically learning the family. They have intervention skills often. They have education skills and engagement skills. They have like a wide array of competencies that they're applying to support early intervention and prevention work. The next category is treatment. And these are providers who do like direct mental health intervention with families. So how the early interventionist may have referred out when they identified like a mental health need already is existing here. They've referred out probably to that treatment professional. And then that professional sort of looks more narrowly into the field, into the needs of the family. And they're really doing a targeted addressing of what was identified. And that's usually through mental health therapy that they're working with a parent and a child together through the relationship, often with a heavy understanding of attachment or in supporting a healthy attachment between the child. They may even be addressing like maternal depression, but whatever is kind of identified as mental health needs, they usually are developing like a plan around that to address that specifically. That's where I sort of started in the field. It was actually a mixture between the treatment category and the prevention category. I don't know if you have similar roles out there, but in Chicago and Michigan, they wanted us to do everything a family could possibly need. So we did home visiting, and I'd say like my role was split between doing case management, where I was really learning about this family holistically and referring them when there was like a physical need, or if there was educational need, or if they needed occupational therapy. I was the one who was kind of learning what the needs were and referring them out. And then I was also, if they had mental health, I did then develop a treatment plan around that and work with them intensely on that. So I kind of did both scopes of practice in that one role, but they really sort of fit, for endorsement sakes, they fit as two different scopes. And really in my work, it did as well. I felt like I was doing too many jobs for one family, but that was how they developed it. And then the last scope of practice is our macro, like our sort of systems level professionals. And this is broken up into 3 different areas or specializations, I should maybe say. The first one is policy and programming. And so these are professionals who are doing state, federal, or local policy development or program development. So they're really supporting like the system around sometimes professionals, but largely around infants and families and what's happening in the community larger. The second one is research and faculty, and that's professionals who are doing research in infant mental health or teaching at a university level of like teaching the workforce essentially infant mental health. And then the third one is clinical reflective supervision, and that's professionals who have done that treatment work and now are providing reflective supervision to support that work and really supporting like the parallel on the next level. So they're supporting the worker who's supporting the parent who's supporting the caregiver and holding in mind relationship and the importance of, you know, our understanding of ourself and our way of being, holding that in mind for the professional so that that professional is helping the parent think about themselves and their relationship with the child and their way of being with their child and their ability to read their cues. So those all fit under the macro category. And then, so like currently I kind of said my role, like a lot of my work around, my work with associations and supporting the workforce is the promotion category where I'm like pulling that expertise into this other type of work that I'm doing. And then I also fit with the clinical reflective supervision because I'm providing reflective supervision and have been for a large part of my career. So I've touched all of the scopes of practice. There's no right or wrong. I maintain the endorsement that I obtained a long time ago because it's you don't have to change categories. You don't have to move up or over. There's a space for everybody, every scope of practice in endorsement. So the first step in you becoming endorsed is you determining your scope of practice. And so kind of as we just talked about each category, they correlate to, or each scope of practice, they correlate to a category. So the promotion category, those professionals who are sort of carrying that torch into their work, educators, medical field, case managers, trainers, those are infant family associates. And this is often professionals who maybe work with the child, but not the caregiver, or the caregiver and not the child. So instead, some of the categories work with both, like they work with the relationship. So if your work is not with the relationship, but is with the child or the parent, and you're holding in mind relationship and you're carrying the importance of that and the competencies that correlate to that, or if you're supporting the workforce, you may fit with the infant family associate category. Prevention and early intervention, that's our professionals who are doing sort of that broad understanding of families. They're doing some brief intervention, but they're really trying to prevent anything that the family is sort of worried about with their child. They're trying to support, you know, optimal growth through prevention. Those are infant family specialists. The treatment category, so the ones who are like kind of narrowing in, they're really targeting a very specific mental health need. Those are infant mental health specialists. And then the macro split up just kind of how I described them. There's a category for the clinical reflective supervisors, that's mentor clinical. There's a mentor research faculty, really explicitly for our researchers and our university level educators. And then the policy is the mentor policy category is our policy and program mentors. So you'll want to identify sort of where you land, and then when you're looking at the competency guidelines, you'll see sort of what's specifically required about them. That'll kind of help you then lean in and learn more about your application process.
So people often wonder, like, what is the most popular scope? Or, you know, people want to know kind of by the numbers. And so At the end of 2023, over 6,500 people had earned endorsement. And here is how it shook out. So the dark gray, the 36%, are those people doing promotion work. So those would be our infant family associates. And then you'll see our prevention and early intervention, the infant family specialist, that's our largest number. That's 40% of the people who have earned endorsement are doing that broader support of the dyad and the relationship. And then they might be the ones who refer out to the 12% represented here in green, to those doing the mental health treatment. And then the other 12% are those doing the macro work. And so this might look very different in Ireland. This again is across 35 or 36 infant mental health associations. But I think it is common to see the family specialist, the prevention and early intervention scope, as the largest piece of the pie in almost all of the places that have licensed endorsement to date.
So what do you need to become endorsed? For each category, there's some specifics that you can look at a little bit more closer. But in general, there's a lot of kind of generally what all the categories need in order to demonstrate competencies. So for all the scopes of practice, you're gonna show that you've developed competencies through your training experiences. So you'll be uploading training, not uploading trainings, you'll be kind of like identifying what trainings you participated in and then what competencies you developed through that. So all categories will be doing that. All categories are going to get 3 references, and that's your community speaking to your knowledge of your infant mental health competency development. So you'll get one from your program supervisor. And then depending on which category you are, there's some other options as well. A peer or colleague. If you're in a category that requires reflective supervision, you'll get one from a reflective supervisor. But each category like really clearly lays out what 3 types of people you request from, and they're just going to speak to your development of the competencies. And then in all of the categories, you're going to be showing that you have some work experience or education, and that depends on the category as well of which one or if both you're showing. So some sort of direct experience as well in the field. Some categories will require that you've received reflective supervision, and those are categories that are directly serving the relationship. So they're sort of targeting working with the family and infant together in order to support the infant. And that's our family specialists, the ones who are doing the broad look at the families, maybe referring out, but they're really trying to do some prevention and intervention work, and our treatment and our clinical reflective supervision. So all of them are sort of really targeting the relationship in their work. And so reflective supervision is required because of the parallel process. It's best practice for all of them. And then you'll see a tab in your application for it, no matter what, because if you are receiving reflective supervision and sort of have that supportive relationship, we know that it benefits your work. We know that, I mean, that's awesome. And that's really ideal. It exists in a lot of communities. It's more systemly exists in the categories that are support relationships because it's so fundamental to your work. If you're going to be holding a relationship, you have to be held through relationship and kind of exploring what's happening for you so that you can do that exact same thing with that relationship. So it's required for those categories that do that dyadic work. And then for the macro mentor category, there's leadership experience required, and that's whether you've supported your association for infant mental health, or whether you've served in any sort of like panel or work group, or you're looking at some policy level stuff, or you're doing trainings in the community. There's a lot of different ways to demonstrate leadership experience. And then there's the passing of the exam for that category as well.
I see a few questions. What if you fit into 2 categories? For example, prevention, early intervention, and macro.
That's a great question. I think there's a couple of ways to look at it. So when you're thinking about your scope of practice, your past experience does not expire. Like all of that competency you developed there still fits. And what you're currently doing might be really relevant as well. So I think that's one angle to look at, is maybe it makes sense to match what you're currently doing. But it's really your journey. And so I think if you're looking at both, or if you're kind of like how I described my first job, that was really exactly those two, or no, it was the prevention, early intervention, and the treatment. I'd say sit down and look at the competencies, and you can kind of determine what makes sense for you based on the requirements that are laid out, based on where you're currently at, based on sort of where you envision yourself. All of those things are things worth kind of like asking yourself. But there's not often like a wrong answer. So you can start your application and change it later if your career changes, or if you find that oh, I need this other endorsement, and your job wants you to get it, or for whatever reason, then you can apply for that it as well. You never have to apply for more categories unless it's sort of like your employer wants you to match your current scope, or your scope changes and you want to match it. So I think it's a little bit of like a little bit of self-reflection and kind of determining what's the best fit for you. But I'd say your first start is you've identified which scopes, and now look at the competencies a little closer, and sort of like in your head ask some of those questions about, what am I currently doing? Where do I see my future? Where am I aligning best?
And I think you said this, I was reading the chat, but like also like really what is the best fit for your community? So like what would, if you really are like 50-50 tied for two sort of categories, what would best support those that you're supporting in your community if you are in that capacity? All right, there's often lots of questions around training. So it is just a broad 30 hours required of training specific to infant mental health relationship-based principles and practices and social emotional development for little ones. That's the requirement. So it's really broad. So we encourage people to really use the competencies themselves as the guide for where you might need to get training. So sort of the key takeaways are, and it really needs to focus on 0 to 3-year-olds. So pregnancy up to age 3. Again, focused on social emotional development and relationship-based practices and things that helped you develop those IAIMH competencies. So we do not require that you upload certificates. This is a real honor-based system. And so if you went to a training, a 5-hour training, and you come back and tell us that you learned about infant young child development and behavior and attachment and pregnancy and screening and assessment and cultural humility, that's what you put in your application, and that is what the reviewers will review. So it's very much honoring that you're going to possibly get something slightly different out of a training experience. Andrea and I could go to the same training and we might come away with slightly different takeaways. So we just want it to be clear that it's focused on 0 to 3-year-olds, social emotional development and relationship-based practice, and then connected to whatever competencies area fit best. You may have already taken 30 hours of training in your career. So this is like really any point in your career, if you went to a training that was meaningful and met the competencies, you can include that in your endorsement application. And or you may find that you want or need to continue to seek out trainings to maybe meet some of the competency areas. We often encourage people to sit down with the competency guidelines and really think through like where maybe do you have gaps, and then that could be where you focus on trainings moving forward to really make sure that you have a well-rounded application. So there's no expiration date on trainings. There's no really requirement on number of hours for any certain competency area. It's again, just really looking at the 30 hours as a whole, and do you have a well-rounded training record for all of those competency areas? I see 2 questions. For the initial endorsement, what time frame is allowed? So for training, no trainings expire. So you can use any training record.
And if you're asking about like, well, maybe you're not actually, but I'll say it anyways. If you're asking about how long it takes to complete it, or how long do you have to complete it, you can open your application and be working on it. Sometimes that's where people sort of learn what more they need to do. So you can continue working on it, you don't have a time limit for when you need to submit either.
Yeah. I see your question, Mary, about reflective supervision. Our next few slides are going to launch into reflective supervision. So I'm going to hold that question. I think we'll answer it here over the next few slides, but we can leave it unanswered for now and then circle back at the end of these slides and make sure that it's answered thoroughly.
So yeah, great question. What is reflective supervision? We keep saying it. It doesn't exist in every community. It doesn't exist in every scope of practice, but it is a growing piece of infant mental health on the national scale. So yeah, I'm glad it's come up and we have slides for it. So this is just like a little definition, you can read about it, but it's really about the process of examining with someone else the thoughts, feelings, and reactions evoked in the work that they're doing. So a lot of the times, you know, I think about my home visiting days, I'd go into a home and maybe I experienced like severe trauma that an infant had experienced, like verbally, or maybe I had to make a call because of something that was reported to me, or just understanding their past. And it's evocative, like it's some of the things that we sit with are hard to sit with. Some of the things that we sit with are amazing to sit with. Sometimes I've sat with kids who remind me of my daughter, and I want to love on them, and I want to play with them, and I want to watch them grow up, and I never want to leave that family. Both things are really important for me to understand that those feelings are coming up, that I'm having a reaction to what's in front of me, a normal reaction. It's not about the reaction being good or bad, but it informs how I show up for that family every time then. If I'm sort of pulled away for some reason, if I'm really, there's something about this parent that just like, oh, it's like hard, rubbing me the wrong way, or reminds me of somebody from my past in a way that's making me pull away from the case physically or emotionally or cognitively. I need to be able to understand that. And so reflective supervision is your space to dive deeply in that, where there's somebody sitting with you and saying like, hey, I noticed that when you brought this family up, you like lit up and you were smiling, and you like, you keep talking about the baby with such joy. Like, tell me more about that. And then I have the opportunity to be like, ooh, she reminds me so much of my daughter. And like, I just want to take her home. And then like, what does that mean then? Like when you know this case is going to end in 6 months? And how has that sort of impacted, you know, when this parent missed those cues? Like, how did that feel for you when you're really connecting with this baby, and the mom didn't see the cues or didn't delight in the baby in the same way? And I get to really do a lot of work around that, so that when I show up back to the family, I'm doing it informed with what's happening for me, and with a little bit of I have a better grip on it, so that it doesn't spill out in ways that aren't beneficial for the family. Or if there's something, I noticed that you haven't brought this family up in a couple of months. And like, are you still seeing them? And like, oh yeah, I am. And, or they've missed a lot. It's like, tell me more about what's happening when they miss. Do you like, I haven't been reaching out. I haven't really been wanting to like reschedule. I wait for them. And it's like, oh, you don't do that with every family. Why do you wait to reach out with this family? So it's just like there's somebody there who it's their role to sort of explore that with me and dig deeper into it, so that I can make understanding of it and not just sort of like float through it. And also it's a really big space where like burnout is addressed and talked about explicitly, where sometimes in our work, I mean, the day to day can just keep floating by, and I can be struggling and I can be burnt out. For me, it was like the system a lot, like the barriers that I was hitting with systems, or like having to write my notes in a certain way so that I could bill for it, that like wasn't quite what the family needed, but like had to do it, or they couldn't get services at all. Like I would start to float through that and lose my intentionality, my day-to-day intentionality. And reflective supervision was a space for me to like wonder about what was happening there too, and like wonder about my burnout, and wonder about, you know, my passion in the field and how that was shifting and moving, like similar, so that I can kind of have a grip on it, so that I can have my awareness of it helps me then integrate, you know, into my work differently. It's a co-created space where the supervisor and the supervisee are really collaborating together in order to do this explicitly, in order to really be pushing into the things that are evoked and that are coming up and that are challenging in the work. And like sort of we're journeying together into a new space. And like it's super strengths based. So similarly to how it's paralleling what we want to be happening with the families, where my supervisor is often like supportive of me and advocating for me, advocating for my growth. And then I've had that experience. And so then when with families, I'm naturally like sometimes unconsciously pulling from that experience to be able to support and advocate and show up for the families in that same way that I've felt it. I felt it and I've experienced it, maybe sometimes in my personal life, but I'm getting it regularly as a professional, so that I can tap into that and be able to do that for others. So that's sort of what reflective supervision is. A big key piece of it is the understanding of the parallel process. I am being held by a professional. I am being kept in their mind. I am being, somebody is curious about my experiences. Somebody is viewing me as the expert of my experience. So their curiosity is not about what they think might be happening necessarily that I don't know about. They just want to know. They want to know what it was like. They want to know what I was seeing, what I was understanding, what sense I was making, what was effective in my work. How did when I wanted to approach something a certain way, or I wanted to have a hard conversation, how did that go? How did I feel it went? How did I think that it went? And then what do I want to do next? So I'm being held in that regard so that I can then hold the family in the regard, and I'm holding them as the expert of their experience with their baby. And when they want to go and try something with their baby, I'm there to be like, what was it like? How did that work out for you? Like when your baby stopped crying for the first time, when you picked them up and you were able to soothe them like faster than you've been able to before, like what did that feel like? And what do you want to do differently with them? And what do you want to keep doing with them? I'm the kind of holding them in the same regard, and then they're holding their baby in the same regard. And they're curious with their baby about like what that was like. Their blocks knock over and they're like, oh, what happened? And then the baby is able to sort of like show them and tell them from their experience, versus the blocks fell over and they're like, let's put the blocks back up. Like, okay, so restack. We get caught up in our roles some way in this, and the parallel process really helps us slow down, be really present and be really intentional and really curious in these like really important moments within relationship. So reflective supervision is, again, I kind of mentioned quickly, but I feel like this is can be a fire hose to the face. And so I will repeat a lot, and you may ask the same questions a lot. And like, please do ask 11 times the exact same questions, so you feel comfortable and so you know what you're sort of embarking on. So it's required for the categories that are doing that dyadic targeted dyadic work. So the family specialist, and the mental health specialist, and the clinical reflective supervision categories. So 3 of the 6 categories require that you've received reflective supervision, and you have to receive from somebody who's deemed qualified, because they are endorsed at either a mentor clinical category, or we have a category specific for reflective supervisors, and that's our endorsed reflective supervisor add-on. And it's an add-on because they're either of the other 2 categories that are doing dyadic work, they're either a family specialist or a mental health specialist, and they've got an add-on to say like, hey, I've got training in reflective supervision, I've done reflective supervision. They've captured sort of like the skills and knowledge for that and added that into their application. So you can receive from either a mentor clinical or an endorsed reflective supervisor. Ireland will not have a lot of endorsed professionals because nobody is endorsed yet. So you will not have an endorsed provider. So what we do in the beginning is supporting a state in the association will be able to, we call it vetting, but on there, and they'll be able to sort of help identify those people in the community. You might have somebody you've worked with who's a reflective supervisor who also is not endorsed yet. And you can go to your association to say, hey, this is my reflective supervisor. I'd like their hours to count. And the association will support that process so that they can be vetted. They'll work on their application. You'll work on your application. And as the community builds and as endorsement, more people are becoming endorsed. it won't be needed anymore. So you'll have like, there's a couple of years in the beginning that Ireland will practice that to support people in becoming endorsed and to keep building the community.
Perfect. I think that answers Mary's question.
Great.
Any other questions about anything we've talked about so far, the competencies, endorsement, or reflective supervision? Because we're going to take a pretty hard pivot in a minute and think through more of like the macro benefits of being connected to the Alliance. All right. Well, if you think of other questions, please feel free to continue to use the Q&A and we'll keep our eyes out for that. So we have just a number of kind of the bigger systems, macro benefits of being part of the Alliance. I'm going to go through them relatively quickly so that we do have time for questions at the end. And at this point, you're probably holding a lot of information in your mind. And I think that this is always the part of the presentation where people are trying to figure out what category of endorsement fits best for me. So it's okay if you're doing that sort of gymnastics as we continue to talk. I see your question about cost, Anne. So the Infant Mental Health Association, the Irish AIM, they're the ones who are going to set the fees. So each individual AIM sets the fees for the endorsement categories. There is typically a registration fee that you, like a smaller fee when you pay when you join the application system. And then there's a fee that you pay at the end, the processing fee. And then there is also a requirement that you are a member of the Irish AIM. So membership in an Infant Mental Health Association is an endorsement requirement. So there's likely going to be 3 costs. And we can, Hazel, you can also add in the chat, but my guess would be that the executive committee, the Irish AIM board, may still be considering what those fees will be. All right, so now that we've heard about competencies and endorsement, we just want to share some of the benefits that we've heard from other infant mental health associations or we've observed by having this national and international hub. So these first 2, legitimacy and recognition, might be, they might be expected, but I think they're important. So because the infant early childhood mental health field is still relatively new, standards that bring legitimacy to the infant early childhood mental health informed work that we all do are really, really important. That recognition leads to the legitimacy leads to recognition for those of us who are doing the work to specialize in this part of the field. And then the third thing, collaboration isn't something that we expected to happen by having this international set of standards. But it's been really exciting to see that when systems and institutions and communities elect to invest in endorsement, they end up working really closely with one another to protect that investment. So the Irish AIM, they've invested in this. They've had some outside support invest in this. You all are here today. You're interested, and there's just going to be some enthusiasm and momentum around getting endorsement up and running. So that may be one of your organizations here offering a training that's focused on the competencies to support the broader group who's interested in endorsement. That may be some of you here today thinking, oh, I already provide reflective supervision. How can I connect with the AIM to maybe start building out additional reflective supervision groups for those who need it? So there tends to be just like this organic community movement to really build up the endorsement community and keep it going so that your numbers can grow and that you can continue to have a cohesive movement around doing what we're all doing internationally. The systems change benefits listed here might not have all that much value to hear for you in Ireland, but I think the takeaway is there have been some states in the United States that have been very successful at connecting endorsement to billing for services. So third-party billing for private practice therapy for 0 to 3-year-olds, but then also Medicaid reimbursement. So Medicaid is our insurance for low income eligible families. And so I think just the takeaway is that endorsement can be a tool that can be put into systems to lead for reimbursement or even higher rates of reimbursement. This is just a slide to show you just a handful of the institutions that we have collaborated with to infuse the competencies into their training or higher education curriculum. So there's bachelor's and master's programs on here. There's training curriculum that is used nationally and internationally, where they have infused the competencies as at the beginning of building some of these programs, so that and looking at Start Early or SEED, the Center for Early Education and Development, they at their onset of creating these, they wanted to make sure that they were aligned with the training or with the competencies, so that when they put the trainings out there, they can say, hey, these were built on the competency-based framework with the competency guidelines. And if you are a person looking for training connected to the competencies, here you go. We have a whole catalog that are already cross-checked with the competencies. So they've ended up being a really wonderful map for people who are creating training or education curriculum. Another benefit is we often produce shared resources that come out of the community. So this guidelines for beginning and maintaining a reflective supervision consultation relationship via distance technology, that came out of a group of people in our community in the Alliance Network shortly after the onset of COVID. And people were saying like, oh, we don't have the skills, or we don't have anything written down to sort of guide this new way of being in reflective supervision relationships. And so put a call out there across the Alliance Network. People volunteered, came together, wrote and produced this document in a relatively short amount of time. The other document here addressing suspension and expulsion in early childhood education settings. This was also authored by a group of 15 to 20 people from the Alliance Network, who all just had a shared passion, need, commitment, desire for a document like this to be created. So there's a lot of opportunity to collaborate and connect across the world with others who are interested in the same topics as you, and have those lead to a resource being produced or published, or sometimes the Alliance puts out a publication like the best practice guidelines for reflective supervision. And then all of us using this endorsement framework kind of use this as a tool to support our own rollout of reflective supervision, our own training of reflective supervision. So it gives us a universal and shared language for all of us who have committed to using this same framework. Another benefit, building on the shared language, is crosswalks. So I have to imagine Circle of Security International is in Ireland. Child Parent Psychotherapy will be releasing a crosswalk with them later this year. I know that the NBO is used in Ireland. A crosswalk with that curriculum will be coming out later this year. Infant massage. I know they have an international branch. So there's numerous national and international curriculum that have been like one-for-one crosswalked with the competencies. And so what we do is go through those training curriculum and say, where are the competencies met? What competencies are not covered? And then so you have a clear view of like what those gaps are. And then you'll see it also goes into enough detail to say what categories of endorsement was it covered for. So this example here is for the pyramid model. So it says for the infant toddler modules, here are the competencies that are covered. They're covered for these categories. What categories are they not covered for? So this is really a tool for the applicant. We want the applicants to be able to see that the trainings that they have attended or are in the process of attending in their professional career are aligned with the competencies. This is also a really nice way for the Alliance and other national and international organizations to see how we complement one another. I think that there's a lot of confusion. There's tons of child serving organizations out there, and there can be confusion around which ones do what and why do we need so many, and are they competing with one another? Are they elevating one another's work? And so these crosswalks are just a really nice way to say, like, look, we like overlap in, 90% of these areas. And then here's where maybe we have slightly different areas of focus. And so here could be a map in terms of where you can get continuing training. So I just only expect this list to grow of crosswalks, and all of these crosswalks PDF downloadable versions are on our website as well. Here's another area of a benefit is that the Alliance, we sit at a lot of tables. Internationally, we have connection with the World Association for Infant Mental Health. And then in the States, we are meeting with 0 to 3 regularly, have a relationship with Indigo Cultural Center and numerous other organizations where when we sit at those tables, we are really bringing the hat of Infant Mental Health Association. So what are we hearing from our member associations about what they need, what they're experiencing in the workforce? And like Andrea said earlier, like there's a benefit for you to learn from the competencies, but also for us to learn about your experience in Ireland and how that's going to inform the larger movement and understanding. And so a big national collaboration that we did in the last 2 years was with the Indigo Cultural Center around understanding, really understanding what we don't understand yet about reflective supervision. So if you use this QR code, it will bring you to a report. It's very lengthy. It's pretty research heavy, but there's a lot of good information in here around really hearing from BIPOC professionals about what is their experience in reflective supervision. So reflective supervision is still a relatively new practice, and what we have known about it largely to date, it has been written and talked about by white Eurocentric professionals and practitioners in the field. And so the goal of this project was to hear from the voices that we have not historically heard from. And so there's a lot of really interesting information in this project that we need to take the next step now and really think about how to integrate this into practice. But we learn about things around, safety. We've often talked about having safety in reflective supervision. And so things that come out in this report are like, you can't just assume that there's going to be safety in reflective supervision, and talking about the power dynamics and what does it mean when a reflective supervisor is just assigned to you in your organization and you don't really have a choice or a say in who that person is. And what if you don't have a lot of personal identity characteristics that overlap with that person? And so what does that mean? And how do you talk about that? So there's a lot in here. And in the next year or two, we hope to be able to offer trainings and webinar modules that really take just a little piece of what's in here and dive really deeply into that to say, and now what does that look like in practice? And so if you're a supervisor, what does this mean for you? If you're a supervisee, what does this mean for you? So that we can begin to change the practice of reflective supervision so that it is more inclusive and accessible. All right, I promise this is our last slide, and then we can go to questions. But your mind is probably exploding with lots of different ideas around what endorsement means for you. But we also want you thinking about what does it mean for your agencies or organizations that you work with or that you're connected to? And how can those places really invest in endorsement? And so there's some ideas on here that feel pretty simple, but we just like to kind of leave you with this. I think it's important to think about allowing your team, if you're a person who maybe is in a management position and you have staff who are interested in endorsement, let them work on their endorsement application when they're at work. Going back to what I shared earlier, we know that when people are connected to peers who have earned endorsement, they're more likely to, number one, finish the project, and number two, to feel positively about it. So let people work on their endorsement applications when they're at the office and working together, and maybe they can get support and ask questions right then and increase the likelihood that they finish that process. Also allow people to attend training on their work time. And so if there is a training specific to the competencies coming up, allowing them to attend that training on work time, whether that's release time or professional development time. We've also had organizations who I'm actually supporting the National Association in Australia right now, and they're really wanting to support entire teams of people going through a competency-based series together. And so whether that is offering something monthly or something at lunchtime over the course of a year, so that you are going through a process with everyone, talking about the competencies and working towards those training hours. Offering reflective supervision to your team. So that may mean you help support someone at your organization earn one of those categories of endorsement that is able to provide reflective supervision. You may bring a consultant in from the outside who's already earned endorsement to provide reflective supervision until you build up that capacity on your own. Or you may just allow staff release time. Maybe they identify their own reflective supervisor, pay for it on their own, but you say that they can do that on their work hours. Another thing to do is just acknowledge and elevate those who have earned endorsement. So I've seen so many newsletters, social media shout outs, going on LinkedIn to really share when people have earned endorsement. I think it does two things. It really highlights and celebrates the person, the individual who's earned endorsement, but it also is getting endorsement out there in front of other people, piquing their interest, having other organizations be like, oh, well, what is that? Maybe I want my staff to become endorsed. And so it's doing both of those things at once. Think about potential partners and funders. So the Irish Association, they can't do everything. And so if they're the holders of endorsement and you're here today and your organization provides training on these competency areas, is there an opportunity for your organization and the IAIM to partner with one another? Could you be a training provider and then they issue the endorsement at the end? So what are those natural partnerships that can be formed that can all sort of wrap around endorsement and support those who are going to earn it? A few other things, consider whether your organization has resources to share the cost of reflective supervision. So could you pay for partial group support for people to earn reflective supervision? Is that something you could write a grant for? I know that we've seen that be successful where people write grants for 2 years of group reflective supervision for 12 participants or something like that. So be thinking about ways in which you can kind of tackle each of the endorsement requirements on a group or a community scale. Ooh, and with all of that information, we want to just leave the rest of our time to answer your questions, but also really just sink into, for however many minutes we have, like, what could this look like in Ireland? What are the possibilities? What potential is there to really roll out endorsement? Begin thinking about training now, begin thinking about reflective supervision now, so that when endorsement is live, people are already working towards some of these requirements. What might things look like? What's the possibilities? Oh, I have a question about parallel process. I'm gonna dive into that a little bit more deeply.
Yeah, parallel process is really that, like, it sort of flows both ways. And so it's the idea of that, like, what I'm experiencing will experience what I'm doing with a family, will experience what a family is doing with their infant. And conversely, what we can see happen too is that what's happening with a parent and child can impact me as well. So like that, we sometimes see as like, oh, a parent sort of is kind of has missed a lot of appointments with their child. They're not taking the child to the doctor. Maybe that's part of what I'm supporting them around. You know, I keep sort of trying to support them and then they keep not following through. And then suddenly I start to not follow through so much with them. And I start to sort of miss appointments. They might have called and confirmed and I missed it. And so something's happening in the relationship that then is impacting the next layer of the relationship. And so reflective supervision in that regard would kind of help me understand that, like, oh, I'm showing up differently with this family, and that might be related to how they're showing up with their baby. But so it happens in ways that are it can impact in any direction. And so what reflective supervision can do also, like what we kind of hold in mind is that we like reflective supervision to be like consistent and predictable and like regularly scheduled, because that can parallel down too, where then I'm a little bit more consistent. I can be more regular with a parent, and then they can do that with their child. So the parallel is just any pattern of that in either direction of like what's happening in the relationship is impacting another layer of the relationship. So different from like a parallel experience where I had a child young and so did the person I worked with. They might also be 20 and parenting for the first time. That's like a parallel experience. The parallel process is more about something that's happening in the relationship that is impacting then the next layer of the relationship. Did that help clarify?
There are actual whole day trainings just on parallel process. It's a big concept, and we gave you just a tiny teaser today.
And some of it can be like really, like I intentionally might do things with my understanding that it could parallel into the relationship. There's also things that happen subconsciously that are paralleling that I just need space to kind of dig into and wonder if what might be happening in the relationship that might be impacting that. And it's a party. It's so exciting that happens.
Thank you, Andrea and Ashley. I'll just give you a minute to catch your breath, because it's hard talking into a screen where you just have to imagine the people are engaged and listening and taking it in. Just know that I was here nodding, even though you couldn't see me. I'm sure others were as well. And I suppose some people have heard some of this before. I know for me, I've heard a lot of it, but it's just really good to hear it again. And I know for people that are out there, it's still very abstract. And it's still abstract for me, but I know in IAIM we have a leadership cohort. So we have a group of, I think it's 8 people that are going for endorsement this year. So we're kind of like the guinea pig. So we're moving from the abstract into what it's actually like to go onto the system, to log your trainings. And it's not as scary as it might sound when you're hearing about it all. And we hope to have that, we will have that all done by the end of this year. And then as a committee, we'll be thinking about how we open it up and whether we are able to open it up widely, or do we have to start small because we don't have a staff. So this is stuff that we are thinking about with the Alliance going forward. So I suppose to keep the momentum going, I just wanted to let people know that on the 13th of June, we're going to have 2 more sessions. One is a deep dive into the endorsement process, and that's from 12 till 2 o'clock. And then from 2:30 to 4:30, we're looking at endorsement and competency guidelines through the lens of an infant mental health case study. So that will help those of you that are here today to get to the next stage of your thinking. And while you're attending those types of meetings, the committee will be attending them and other meetings with the Alliance to help us to think about that kind of strategic stuff that we need to keep an eye on to support access to competency-based trainings, reflective supervision, all that stuff that we need to do in the background. So it's a big job, but we can do it.
Yes.
There's no other questions. I don't know. Yeah, I don't know. Does anybody else have any questions there? Let's see.
Well, let's give people a second to think. I want to pull up the link that I said I would share in the chat around the exam materials.
And while you're doing that, people may not have seen that somebody did ask a question about the exam. There used to be an exam for the infant mental health specialist and then for the mentor ones as well. And the specialist exam is not happening anymore. So it's only for people going for infant mental health mentor. And then the other piece to note, just with the language, because we used Irish language for the competency guidelines. So when Ashley and Andrea are talking about infant family associate, in our competency guidelines is infant family support worker, just in case there's a few discrepancies for people.
Yeah, thank you so much for calling attention to that, and I apologize for not remembering.
Yeah.
I see your question, Catherine. How many AIMs have dedicated administrators to help with their endorsement process? I would say all have someone dedicated. It's a matter of whether it's a paid dedicated person or a volunteer person. And I think of the 37, my last count was that there were 7 who still have someone in a volunteer capacity. So it is certainly the smaller amount. And what we have heard from them and what we've seen and experienced is that AIMS are certainly still able to operate endorsement when they have someone in a volunteer capacity. It's much more challenging and the growth is just much slower. So it's a lot harder to get to the tables and do the marketing and talk to people about it, while also being the one who is in the endorsement application, providing individual applicant support, coordinating reviewers, coordinating the exams. There's just a lot of layers. And so it is much easier to do when there is resources that support that role.
I've just recopied that link because Sharon let me know that panelists, people can't see when you put a link in. So I've just copied the link about the.
Oh, okay. Thank you.
And I know as a committee, we'll get to think about some of that stuff around administration in a smaller group as well. Yeah.
Yeah, really try to start doing some of that strategic thinking ahead of rolling it out.
Mm. There's another question. So Lorraine's just saying, thank you for this, so helpful. When I think of the visibility that people who work with us in parent and baby groups really need and want to support them and the families, even if it takes us 10 or 20 years in our area.
Yeah, it can take time to develop this and to get to be seen and understood in the work that we're doing, but it is happening faster and faster because the international community is growing and finding more language and finding more advocacy. The Irish AIM is connected to the other 36 AIMs now, and sometimes even sharing in funding. So I do think it's growing faster, but yeah, it takes time, but it is worth the journey.
Yeah. And I think we're in a good place in Ireland. On the 25th of April, we had an event for a whole day with people presenting on infant mental health work. And it was the first time that we had all Irish presenters. We didn't have anybody coming in from outside the world sharing their expertise because it was all from within Ireland. And that wouldn't have happened 10 years ago. So I think we're on a path.
Yeah, that's an awesome measure. An endorsement can kind of end up being a measure as well too, because you'll start to see the reach of look at all of these different communities that were not at this table before, were not calling themselves infant mental health professionals before, didn't know that they were, so pivotal in the infant mental health community. So I look forward to kind of hearing what more milestones you guys reach as you keep growing.
Okay, there's another question. I'm aware that we have to finish at 4 because I know you have to go and present at the conference you're at today. Is it 3?
The question.
So Stephanie's asking about the application. So Stephanie, what's happening at the moment is just the leadership cohort are doing our applications through the Alliance. And then once we are endorsed, we will have our own system on the IAIM website. But I suppose over the course of the next 6 to 8 months, we'll be keeping our members and others up to date on the progress. So the first bit is to get us endorsed. But as I said, in the background, we'll be working on getting all that process up and ready on our website. But yeah, it'll be through IAIM then from next year, early next year.
Yeah, I was just going to add, I think going back to one of the questions earlier around reflective supervision, it's probably feeling like right now, like, oh, there's just not that many providers of reflective supervision, or, you know, at least not qualified providers yet. And because of endorsement, we've really seen that be an area that states grow because of these requirements. Like without these requirements, it may be that people continue to bring people from out of state or out of country in to do those services, but the endorsement requirements sort of like push that capacity to be built locally, that in 5 years' time, you'll have so many qualified providers of reflective supervision who are here and able to provide it locally and in person, and in, you know, really identifying all the ways that that digging deeper report are probably best practice. It's probably not best practice to always bring someone in from outside who doesn't understand or know your community as well as you do.
And we have a lot of mental health learning networks around Ireland, and a lot of reflection happens in those. And I think some of that, participating in that can go towards your reflective practice as well, can't it?
Mm-hmm.
Yeah. So it is coming up to 4 o'clock for us. So I just really want to thank you, Ashley and Andrea. It was really great to hear all that you had to share today. And for people that are still here, we have recorded the session and it'll be made available. It will be made widely available. It's not going to go in our members section of our website or anything. So it can be shared with people who you think might want to hear this. So please go out and spread the word. And we'll also send you the details about our event in the 2 events in June as well.
Thank you so much for having us.
Thank you. Really appreciate it. Okay, take care then. Bye-bye. Thanks, everyone.